Hi, this is Dr. Roman again. So I want to just talk about some of the diarrhea cases and GI problems that dogs have that are very common that can really be helped extensively with doing the fecal transplants. So whether you do them orally or you do them as a slurry rectally, they are going to give more numbers of microbes and distribution, more symbiosis in the gut, and it's important. So I'm going to tell you about this dog, Doug, who was taken to two doctors prior to going to a big referral hospital. And he was 6 months old. He came off the plane with diarrhea. They took him to the regular vet, and two veterinarians, they put him on metronidazole, they put him on all these medications, they dewormed him, they did all this stuff. Couldn't control it. Went to the specialty hospital, saw 5 separate doctors at the specialty hospital, each one doing their tricks, and nothing was happening. This dog was having diarrhea 6 to 8 times a day, 5 times a night. People were depleted. They weren't sleeping at all. They were exhausted. And they even got a fecal transplant at that referral hospital because the owner requested it, and it really didn't work. It reduced the urgency in the middle of the night from 6 times to like 4 times. But that's like an extra 3 hours of sleep, so that's significant. But once they got our fecal transplant, in 2 days, the dog's stools were normal. And it was a huge difference because we're not only giving them a better donor, the highest quality super donor, but we're also giving them the tools to restore the gut. So the nutritional support that we're doing is not putting them on a diet that is dead of life and has very little support for the microbes. So we're trying to encourage a better diet and as well as adding these microbes. Dogs that have had chronic diarrhea for months, years, weeks, if we get them back in their symbiotic balance, then hopefully we can get that microbiome to click on and hold on and start to help that dog rebalance itself. So it's really important to know the dogs that you're using. And that's why Legacy Biome has been only using my dogs, which are my 6 generations, now a 7th, but 6 generations that have never had antibiotics, have always been cared for in a holistic way, that their legacy of passing it from generation to generation to generation, which is where the quality of this donor exists. And so I'm excited that you have found this website, that you are looking into doing better care for your animals, having your vet be your partner on this and getting to understand why it's so important to select an excellent donor, not just any dog that has good stools. That's not good enough. That's not good enough for me. And I think that having a high quality microbiome is key to the success of doing FMT, if you want to call it that, but I like to call it microbiome restorative therapy. Thank you very much.